Okay, hi everyone, welcome to our second episode of Assunta Podcast. My name is Daniel.
And I'm Alia. Today we'll be discussing about ASSISS, which is our Assunta Hospital Charity Week, with our special guest, Dr. Darshinia, Head of Medical Service.
Alright, so without further ado, let's begin.
So our second episode of Assunta Podcast, which is what is ASSISS. So Dr. Darshinia, today with our guest is Dr. Darshinia. Dr. Darshinia, maybe can explain regarding ASSISS and also you yourself.
Good morning. My name is Dr. Darshinia, as you have already mentioned, and I'm the Head of Medical Services of ASSISS. So many of you might be a bit confused with the designation. What is the Head of Medical Services? A little bit on what we do is that in ASSISS we provide medical services within the community, closer to the patient's home, but this is more towards the poorest of the poor. So in that sense, what I do is mostly governing the medical services that's being provided to the community, to the doorstep of the poorest of the poor. A little bit of my background, I have been trained in public health, and it has been actually an honor to work with ASSISS.
Okay. Alright, Doctor, can you elaborate more regarding ASSISS? Basically, what's the component of the ASSISS basically? Because what we know basically ASSISS is to help the poor, to give back to the community. So is it any component that's included in the ASSISS?
Yeah. So before we know what ASSISS does right now, it's better to know a little bit on the history. So ASSISS is actually Assunta Integrated Social Services. That being said, Assunta Integrated Social Services is the charity arm of Assunta Hospital right now. The hospital we have right now was initiated by charitable initiatives by the FMM nuns long before our Merdeka. That's in 1954. We had 2 or 3 FMM nuns who went on bicycles serving the poor medically around Petaling Jaya. At that time, Petaling Jaya was a very small and secluded, sort of like a village. It's not a city at that time. And slowly, as we got our independence, we had a lot of government hospitals sprouting out, and Assunta by itself had to sustain financially to continue the charity initiative.
So is it the charity combined with the government sector, or we Assunta Hospital stand alone to give the charity to us?
Assunta Hospital stands alone
Stands alone.
to serve the poor. So we created a hospital to generate revenue, and from the revenue 50% goes back into charity, just to continue the legacy of the FMM nuns.
So who are the category that entitled to get the service, basically, Doctor? Before that, so what is the services that ASSISS provide?
So we have 6 different components. Social welfare being the first primary. Under social welfare, we have outpatient and inpatient. So outpatient, we identify B40 families and we provide them with an outpatient card. And if anybody falls sick within the family, they will come over to our emergency department and they will be seeing our medical officer. If they need further investigation, we will do the investigation for them. If they need to be seen by a consultant, we will refer them to the consultant. And if they need surgery, then this patient will be converted into social welfare inpatient to be admitted for investigation and surgeries and anything that requires an inpatient treatment. So that's social welfare for you. The second is ASSISS wound care services. So any B40 patient who has a long-standing or a short-standing wound, any kind of wound, we will actually receive the referral, or they will walk in requesting for our services. So we will deploy our staff nurses to the house to provide wound dressing. It can be daily, it can be 2 days once at the beginning stage. And what the nurses would do is also that they would train the caregivers or the family members to do the dressing in their absence. So we sort of prepare the patients for the worst and the best. And so far, wound care, we have been able to treat the wounds within 4 weeks. Any kind of long-standing wounds. The third component is ASSISS Geriatric Enrichment Services. Here, most of the time, the B40s, we have a lot of abandoned senior citizens, where I would not say they are purposefully abandoned. Some do not have any children, and some are living very far away from the children who are working elsewhere. So these patients, we accumulate them and we give them games or trainings that can prevent them from getting dementia or delay the progress of a dementia. And through ASSISS Geriatric Enrichment Services also, we provide volunteer training, because our physiotherapists would not be able to be deployed all the time with the patients. So if we have already trained volunteers, they will be deployed to the patients' houses to do things like respite care and so on. And after that, we have ASSISS Stroke Ancillary Program. For stroke-ridden patients, we deploy our physiotherapists to provide physiotherapy at home. And we have ASSISS Palliative Services for terminally ill patients in need of palliative services, such as treatment for symptoms like prolonged vomiting or pain. So our palliative care trained nurses would be deployed there, and they will be providing the services for free, medication as well. Finally, we have mobile clinic. So mobile clinic is one of the very first components that was coined under Assunta Integrated Social Services, basically because it was started off with a mobile service by our FMM nuns. Right now, mobile clinic, we have 2 teams, which comprises of 4 nurses each team and 1 locum doctor, and we go to 48 different locations every month to serve the B40 community within the locality.
Means that, doctor, okay, like what you say, social welfare. So how we identify that a person is eligible to the services and everything? Because we know in Malaysia there are kinds of people.
Yeah.
So how we engage that these people is really entitled for that
Right.
services?
Yeah.
Because some people they
Yes.
you understand what I mean?
Yes.
So how ASSISS determine this kind of people?
Yes.
Or we got any range of, like, our coverage is for only Klang Valley, or outside of Klang Valley we also can provide them these services, or how is it?
Right. So the criteria to begin with, our criteria is for Malaysians and B40. So they have to be Malaysians within the B40 clan. And how we identify the B40, we have a few ways. So we liaise with Jabatan Kebajikan
JKM lah.
Masyarakat. Yes. And if they already provide us with a list of B40s who have registered under JKM, these people automatically are eligible for our services. Apart from these patients, we also have some who are not inclined to registering under JKM. So such patients, when they walk in, we will do our own financial assessments. That's eightfold. They'll fill up some forms. Our nurses will be going to their houses to do a little bit of interviews and background check. And if they pass through all of it with the required documents, then they fall into the eligible category as well. And if you ask me about the vicinity or the area of
The coverage area.
so within Selangor and Kuala Lumpur, as long as they are within 60 kilometers radius of Assunta Hospital, they are covered. Sometimes, if the patient is too serious or they are in a dire need and there's no coverage of any other community services, we go out another 2 or 3 miles from the 60 kilometers. So that is based on our flexibility and the need of the patient. But outside Kuala Lumpur and Selangor, we also cover Negeri Sembilan, that's Port Dickson, Rembau and Seremban. And in Sabah, we also have clinics, and those mobile clinics go to 7 different locations as well. So that's a long list of clinics.
Okay, understand. So means that once the person who are eligible, so they will receive something like medical card, or is it?
Yes.
So it's call it ASSISS card lah.
Yeah.
So they can come to Assunta to seek for medication anytime that, if let's say they are feel not comfortable or what lah. Is it?
Yes, but so just to eliminate any misunderstanding, that Assunta Integrated Social Services outpatient card, they bring to the emergency department to see the doctor first. So sometimes, sometimes when you have a medical card, there is a belief that you can just show the card and get medication. So we don't do that because why? We would like to eliminate the unauthorized transaction of medication and drug. Sometimes there can be misuse. Sometimes those drugs may cause side effects to the patients. So what we do is, it is preferable for the patient to see the doctor and get a consultation and advice from the doctor first. And if they really need medication or investigation, then the doctor would decide for the patient.
Understood. Okay, doctor, let's say regarding the medical card that you mentioned just now, is there any limits for the card?
No, there's no limit.
Understood.
So means that if let's say, and for example, so like they are doing dialysis, so they are full, dialysis center are full, so they are using the medical card, they can do dialysis in Assunta Hospital, is it?
For now, we have not opened up for dialysis yet. The reason being is chronic illnesses like diabetes, kidney failure, they already have a follow-up with a certain specialist or a specialized clinic. Us allowing them to, how do we say, do separate shoppings on consultancy, right, will have a conflict of interest on the treatment.
Understood.
So the medication that we may provide at Assunta Hospital versus the one they are taking in brand, in terms of brand and dose, may not be the same. So chronic ailments, we would always take it with a pinch of salt first. Yeah.
Okay, understood. Okay.
Alright, so doctor, so other than social welfare, mobile clinic is also the hot topic in ASSISS lah, basically, because I'm also staying in Klang very area. So basically, I got seen before like social service, like community. They do ASSISS doing some community work in the Pusat community.
Yes.
And then how you engage with this kind of community, basically, doctor? Means is it you engage with the Ketua Kampung or how is it?
So my nurses and myself, usually we go down to the community. If we see that it is a bit more terpencil, then we try to identify the Ketua Kampung. But very recently, after COVID-19, JKM has been very, very helpful. They came to us requesting for assistance as well on the medical side. So we go both ways. When the government or non-governmental organizations adhere to us, advising us to go to a certain community, then we go with them as them being our coordinators. But there are also locations where we go down and then we try to identify the person in charge, like the Ketua Kampung or any coordinators, individual coordinators, and we coordinate with them to create the mobile clinic.
So what basic treatment that you give in the
Mobile
mobile clinic communities?
It's a very basic general practice treatment. And we, of course, we check their sugar, their blood pressure, their temperature, all vital signs will be checked. And we listen to their ailments, just like any patient going to the clinic and saying, doctor, today I have a fever, or doctor, I have a body ache. These things, we see exactly the same way at the mobile clinic. And we have nurses who will take up their vital signs, their observation, and they will dispense medication as well.
So means that every month ASSISS already have their own schedule. For example, this week where we are planning to go.
Yes.
Alright, so Alia, so we already know some of the services that ASSISS provided. Okay, so doctor, maybe you can ask what's the planning of ASSISS in this year or the blueprint of next 5 years?
Yes.
How about that?
So I would prefer to keep it a secret part. I will give you an overview. ASSISS right now is catering to 48 different locations as mobile clinic, and we are trying to branch out to the most underserved areas, the most underprivileged. It is still a challenge to get those underprivileged to come to us. So my hope for 2025 is that we have more collaborations with government and non-governmental organizations who can assist us in reaching out to the poorest of the poor. The work is still in progress, and of course we would also need the public support in terms of other resources. So please, I just hope they would feel free to reach out to us.
Okay, so doctor, you just mentioned that the underprivileged sometimes they cannot reach out to the ASSISS. community. So meaning that how
to them to reach out?
yeah,
Oh, okay.
the way for them,
Ah.
yeah.
So we at the Assunta's ASSISS link,
Mhm.
you will have the contact number
Mhm.
of ASSISS office
Mhm.
and the details of if you have donations, you have a link to donate,
Mhm.
and you have our contact number to just call us,
Mhm.
and they will get all details that they require. Yeah.
Okay, understood. Okay, so maybe we can jump to the conclusions. Okay, so then regarding the conclusions
Alright,
for today's
so
topic.
what we have learned today is regarding ASSISS, like basically the component of ASSISS. Basically, outside there who want to have a service of ASSISS, you can, like what Dr. D say, you can go to our website, ASSISS website,
Yeah.
and then you can contact us lah in that link below. Okay. So that's all for us
and,
today.
Yeah, and also maybe any last word, Dr. D, to the listener?
Oh, so actually, public health is something that not many people take seriously.
Yes, yes.
And if, let's say, you do know anybody within your community or neighborhood that is in need of medical help, but they are not reachable by these organizations that are available, please do not hesitate to contact us.
Okay, so thank you so much for Dr. Darshinia for joining us today. Okay, so that's all for our second topic. So we will see you again later for the next Assunta podcast. So thank you so much.
Alright, thank you guys for
Thank
watching.
you.
Alright.